Hi, this is Karen Garrison from Connect Consulting Services, and we are here to learn how to use your emergency preparedness toolkit. Thank you for joining us this morning. My name is Karen Garrison again, Director of Aging Services. Just a little bit about me. I've directed a wide variety of nonprofit programs that support seniors and disabled adults in San Francisco. Some of the programs that I've actually run are in skilled nursing facilities, memory care settings, assisted living, ADHD and CBAS, day programs, supportive senior housing, clinical case management, and national service programs. I've been with Connect since 2017, and a large part of my job is developing emergency management training like this one, quality assurance, CMS compliance reviews, emergency operations plans, and lots of other things and services and tasks. This is, we'd like to know a little bit about you, so that's what this slide is about. And in terms of training objectives today, we're going to review the 4 elements of the CMS preparedness program. We're going to review the essential elements of the CMS toolkit. We're going to learn how to make the toolkit templates really your own, and we're going to lead an open and interactive discussion about how to use the toolkit. So today is meant to be a very open-ended discussion. We purposely did not put a lot of slides in here because we wanted to really have more time for discussion. Excuse me. There are 4 main elements to the CMS Emergency Compliant Preparedness Program that CMS is really expecting you to have in place. You really need to do a risk assessment and an emergency plan based around that risk assessment to your local community and your facility or your program specifically. You need to develop policies and procedures that are specific not only to your center or your program, your organization, but also to your provider type. We'll get more into that as we go along. We're going to create a communication plan, and then you also need to train and test your emergency operation plan through exercises and training. Just wanted to say a little bit about the fact that there are a number of new regulations that CMS they're either new or they're changed. And so as of November 29th of this year, so just in about a month, there's several existing regulations that actually are changing. And so we just wanted to give you the highlights of that, such as removing the requirement for emergency preparedness connection with local, state, regional, and federal emergency management officials. That used to be something that was a requirement, and as of November 29th, they've actually taken that requirement away. It's still an extremely good best practice, but that is no longer a requirement that you actually have to have those relationships and efforts to create those relationships. Anyway, we also, there is also a rule change around reviewing emergency plans. So it was once a year, and currently the new plan is going to be every other year. Now, the one exception to that is if you're a skilled nursing facility, you still need to review your plan annually. And with training, staff training was an annual requirement. Now it is every 2 years. You need to do an annual training for your staff. Again, if you're a skilled nursing facility, this rule change does not apply to you. Lastly, they have reduced and changed the testing requirements from 2 exercises annually to 1 exercise annually, which may be either a community-based full-scale exercise or an individual organizational functional exercise or a full-scale exercise. So they're asking you they're giving you more choice. They're making the frequency not as intense. These are all changes that, again, will be in place as of November 29th. Again, if you're a skilled nursing facility, none of these changes apply to you. So you need to still do an annual 2 exercises annually. You still need to review your plan annually, and you still need to train your staff annually. Okay, there are 4, excuse me. Why we prepare? This is really an important question. Now, CMS, before the final rule, I think they were much more lax about emergency preparedness. And so really this slide is about the intention of CMS and why they instituted these new regulations across the board. These regulations, the group of regulations are really called the final rule. That's how they are actually regarded. And so some of the reasons that these new regulations have been put in place over the last few years is to standardize emergency preparedness practices across the continuum of care. So from a FQHC to a dialysis center to a skilled nursing to a hospital, everyone is actually working with the same regulations, which makes it much, much easier to actually have the same information, the same training, the same exercises, and it standardizes that approach to emergency management. Also, these are emergency management and business continuity best practices. It prepares providers in especially vulnerable communities during disaster. So training and exercises and planning goes across the board in different kinds of communities so that everyone is more prepared. Also, there are better health outcomes for vulnerable patients. And lastly, it allows organizations to proactively plan and train and exercise for all types of disasters. Excuse me, having a mouse issue, so please. Okay. All right, this is actually a checklist and you actually have these handouts that are downloaded on this recording. And this particular checklist will actually be emailed to you as well so that you will have it. So this is a checklist that really tells you what the requirements are, requirement by requirement, and it actually matches up with toolkit annexes and appendices. So we wanted to make it easy for you to see what CMS really requires and really what is an emergency management best practice. So it allows you to look at the toolkit in more of a holistic manner to really see what works in your organization and what the requirements are in a very in-depth manner. So the main toolkit elements are, and these are we'll talk more about the sections, but this is as an overview. These are the main pieces of the toolkit that you will be creating to create your emergency preparedness program for your organization. So there's an area called an emergency preparedness program plan. I call it an EMPP, which is, we'll talk more about that in section 1. Site-specific annexes and appendices, that's in section 3. Communication plan is in section 4. Hazard response guides, which tell you how to respond to specific hazards, are in section 5. Incident command system documents are really throughout training, which is 6 and 7, but also they're in section 3. Training and exercise resources, again, in section 6 and 7, and sample policies and procedures are actually in section 9. So all of these are essential elements of your program, and they speak to, and they all are different. So it is a lot of elements, but they all have very specific purposes. Okay, again, there's 9 main sections of the toolkit. And again, every section has a very specific purpose. So you'll see 9 there. And again, that kind of matches up with what we just talked about. Again, the EMPP, We have a hazard vulnerability analysis, all your plan appendices, communication plan, hazard response guides. And so it all matches up with the toolkit, matches up with the requirements, which matches up with the checklist. So that you should be able to create your plan and fortify and improve what you currently have in your emergency operations plans or whatever documentation you have. Okay, so section 1 is the emergency preparedness program plan. So this is about a 30-page document, and it details the structure of an all hazards planning approach. It includes some incident management system theory, demographic information, and site-specific information. Now I have to tell you, the toolkit is all about templates, so we're actually going to have a section further down in the training about how to create, how to kind of customize the templates to be really your own, which is the name of the game with the toolkit. This section, the emergency preparedness program plan, also provides general guidance for primary resources and internal capacity during a disaster, and it outlines the procedures for major tasks as notification, organizational structure, and emergency operations center coordination. So this section, it sums up all of your emergency information in one easy to use place. Okay. Section, now I want to talk a little bit about plan appendices. These are throughout the toolkit, but these are actually appendices and annexes that allow you to, they're the templates that actually guide you through the process of creating your plan. I'll give you an example. You have in section 2, appendix 1 is a hazard vulnerability analysis. That's going to tell you how to actually conduct one. And that's also going to be a placeholder when you actually create, you actually do your HVA, as they call it. It allows you, it allows you to, again, learn how to do it, but it also is a placeholder so that you can actually have, when a surveyor is looking for that, they know exactly, you can say, oh, that's in section 2, and I know exactly where that's going to be. You also see that there's building maps and inventory lists and checklists and backup records. So, and service location. Many of our clients, many people who actually purchase these toolkits have multiple sites, so it's really important in your documentation to lay those things out. Where are those sites? What services are being provided in those specific sites? And so each appendix or annex has a very specific purpose. Okay, section 4 is about a communication plan. This is really, really important that it's very important that you have those vital numbers that are on the tip of your finger. That during a disaster, you can't be looking in a book, in a huge binder to look for a phone number, because it adds to the stress. You want to have it all streamlined. So communication plan gives you instructions for leadership to communicate with staff and patients and outside vendors and other entities, and even volunteers during an emergency. So it really is guiding you through the process of communication during a disaster. It also includes your internal and external contact information. Again, I'll give you an example. If you're a skilled nursing facility and you have a vendor that brings your oxygen, you need to make sure that you have that number right in the communication plan so that you can call them very quickly if you need extra supplies during a disaster. The communication plan also, it really lays out what are your redundant communication devices, and things like walkie-talkies and satellite phones. It's not a cell phone. A redundant communication device is not a cell phone. I think often people think that cell phones are redundant. communication devices, but often during a disaster, cell phones are the first things to go. So you really need a way to, determine what works best in your community. In your community, if you're in a super mountainous area, you might need a satellite phone. In other areas, walkie-talkies work great. So that's a whole other discussion, but this is actually where you plan that and you document in section 4. Okay, section 5 are hazard-specific response guides. So the thing about a response guide is that it's a way to identify issues during a specific type of hazard. It could be anywhere from a tsunami to a hurricane to a fire to an earthquake. And you know that, within your area, we're in Northern California, so some of the big issues, hot ticket issue hazards in our area are wildfires and earthquakes. Those are probably the two that will affect the Bay Area more than any other. And that's definitely true right now. There's a number of fires and blackouts and things like that. So it's really about looking at what your biggest hazards are, maybe reviewing your hazard vulnerability analysis, yes, section 2 over there, and making sure that you understand what are your top 5 to 7 to 8 hazards that you're most likely to experience, and then proactively planning around those. How is my staff going to be communicated with during that particular kind of, during a power outage or a fire or whatever it is? Also, what are the considerations for a tornado or a pandemic flu? So what are all, you really have to look at what your greatest hazards are and really proactively plan around that. Also, hazards may be intentional or accidentally. And so there's lots of, I think it's really about understanding what your risks are and then planning proactively around that. And that is section 5. Excuse me. Section 6 and 7, I'm actually coupling those on one slide, and it's because staff training and exercises really go hand in hand. So I think it kind of makes sense to put these two things together. So section 6 is about staff training. Now, I think staff training is something that often people might think, oh, I just need an annual training. Well, it's probably more than that. You need more frequent training. And the only way to really do that, you're all working in sites that are very busy. Everybody is busy. And there's lots of competing training. So you might be having to do infectious waste training, or you might have to do HR training. You might have to do other kinds of training that are site-specific or provider-specific. So you want to make sure that you incorporate training into what you're doing already, because you're already training your staff. So you want to kind of be able to incorporate emergency management, emergency preparedness training together. And so these documents are going to actually help you to plan training out throughout the whole year. One question I have is, do organizations normally train their new staff? Because that's a CMS requirement. So being sure to make sure that you get new hire orientation for training is important. So these training documents will allow you to plan forward for the coming year so that you can make sure that you incorporate as much training as you need for your staff. Section 7, and I'm sorry, there's a typo there, but that is actually, we do under section 7, it's all about exercises. And so you've trained your staff on your emergency preparedness procedures, and now you want to test them out. And so you hear on section 7, we've got how to create a CMS compliant exercise. That's really important. That's a step-by-step guide of how to actually create a exercise. From the planning steps to the facilitation also to the evaluation pieces. Also, how to create a after action report. There is a template there so that there's no guesswork. And so when you do your exercise, you always want afterwards to do a really thorough after action report and discussion about how well that exercise went. Well, sometimes exercises go great, but sometimes they don't go so well. And the whole point of exercises are to for you to test portions of your emergency plan and see if they work. So if you do a communication drill and you try calling up all your staff and half their phone numbers are wrong, you know that you've got to work on those areas. So these templates really help you to do that. And also, it's really important that you're documenting all these pieces. So it also has exercise documentation within these sections. Okay, so alternative care sites. It's really, really important that if you can't operate your services out of your existing site because maybe there's a wildfire and you've had to evacuate, that you actually have that planned. Because moving not only staff, but frail or vulnerable populations of clients or participants or patients, whatever provider type designation you have, that takes planning. And the only way to do that, and not planning on the fly, that's planning before so that you understand where you're actually going to bring these people, what supplies am I going to bring with me, and how am I going to do this if I have no power and no transportation. So it's really thinking proactively ahead of the game, and these documents allow you to do that. So they're really templates that allow you to kind of figure out what elements do I need so that I can maybe operate at a different site. If I'm a FQHC primary care clinic, I may need to set up in the local senior center or the local school for a while so I can continue providing care to my patients. And that's what Section 8 is all about. Section 9 is policies and procedures. This is very specific to specific provider types, meaning, now I've only listed a few of the templates. I've listed, and these are actually probably the ones that, you know, for medical providers that they need the most. But FQHCs, federally qualified health centers, as an example, only need these particular policies and procedures. They need safe evacuation. They need to know how to shelter in place. They need medical documentation, and they need to for the use of volunteers, and that is actually medical credentialing. And so these policies and procedures really guide you through that process. Again, you're planning these things. I have to say many providers, and there's actually 10 policies and procedures total. So if you're a PACE program, you have to actually do 10, all 10 PMPs. If you're at FQHC, you do 4. If you're skilled nursing, you do 8. And that is based on the type of service that you're actually providing in the community, the acuity level of the client, patient, or participant that you're working with, and really it goes back to the core services and the core deliverables of the type of services you are actually providing. And so I'll give you an example. PACE programs, which is Programs for All-Inclusive Care for the Elderly, which is a combination of a day program and a public health clinic, and a clinic. I wouldn't say public health. It's an all-inclusive system of care, but they're actually also there's a home care component. And so PACE programs take care of their participants in their center, but also at home. And so they have an added responsibility of having the responsibility of monitoring and providing services 24/7. And so that is why they have all of those policies and procedures. Okay, now, okay, I'm actually gonna go back to PMPs one more thing. I wanted to say one more thing about policies and procedures. Policies are really why you do something, and procedures are really how you do something. And so as you're developing it, think about those two elements and how they go together. Really, the policy supports the process or the procedure, and the procedure supports the policy. And so it's important that those two coexist. And it also is an easy way to really train staff. You might actually be able to take a P&P, your completed, and maybe bring it into a staff meeting. And so quarterly, you're going to talk about how to shelter in place. And the easiest way to do that is to take your policy and procedure and just pass it out to the staff and discuss it. It's a great training opportunity. Okay, so we're now going to talk about, we're going to transition from the elements of the toolkit to really how to make the toolkit your own. We're calling them toolkit templates, and there are over 30 toolkit templates. So when you actually look at all of the templates, it can be a bit overwhelming. But again, I want you to go back to looking at the startup guide to really determine, that will guide you a lot, because that will actually tell you which sections each annex or appendix should be in. And that will actually allow you to organize your information in a much easier way. So these templates are all, the information is amazing. It's very comprehensive, but it's really important to look at each template and see what really works for your organization. You might also have a lot of existing emergency preparedness documentation, and you don't want to throw that out, the baby with the bathwater, so to speak. You actually want to see if you have policies and procedures, or if you have plans or processes or whatever for emergency preparedness that currently are working for you. You want to be able to incorporate what you do well into these templates, as opposed to just starting from scratch. The whole point is that you want to marry basically your existing systems that are working with the toolkit, which is actually, the templates are really a great framework, and they're all CMS compliant. And so it's really about bringing those two together. So I always say that working with the toolkit is like a big editing job, because it is. You're really looking at what the toolkit has, what each appendices and annex has, and determining what really works for you. So here's some little tips on how to customize these toolkits. Now, I'll start off by saying also that we've actually worked with several providers who have gone through surveys. And I think one particular provider that we worked with, we were asked to consult after they had gotten surveyed, and they had several dings, pages and pages of dings. And what they didn't do, what they had was a rule book. And I think their mistake was that their rule book was the regulation book. And I think they felt that that was because they had that was their plan. And that's not their plan. So what you really have to do is to take the templates, look at them, and really see where you what works for you and what the requirements are. And then you really want to customize them. It's really about, and you'll see with each template, all in black, but wherever it's red, that's information for you to input. And so it's really taking the information that is site specific to you and actually incorporating again into each template. So I'm going to say, start with section 1, kind of work your way to section 9. So I think it's very easy to kind of go all over the place, but I think if you start at the beginning and you end at the end, that is actually the most effective way to use the toolkit. I always, again, there's over 30 master files in there. And I am a big one for version control. And we're going to talk a little bit about that on the next bullet. But I found that when I've actually used the toolkit on projects, and that's what we actually use the toolkit to, as we're working with organizations' emergency operations plans, and we incorporate, again, their information into the toolkit, and it becomes a very specific annex or appendices to that particular organization, and that's really how you make it your own. And so I would actually initially, when you get the download, copy them into a toolkit file. You can call it anything, but I actually always have a master toolkit file where I just store my files there. Okay, I think it's very important to kind of have those clean masters over here in that subdirectory. And then I have a new toolkit file subdirectory. And so as I actually work with each file, I'm gonna, you know, copy it, and I'm gonna do a save as. I'm gonna save the new version over in the new toolkit file. So originally, you know, so you're gonna have your masters on one side, and you're gonna have your new files on the other. And if you actually do that, it actually really helps to keep the masters clean, and the new file is it will be much easier for you to manage from a file management perspective. Version control, very, very, very important, because I know that when I'm working on documents, and these are a lot of documents, you want to make sure that you're labeling them version 1, version, you know, and everybody has a different way of doing that. I put an example over here. It says V0R2, which would be version 1. R2 would be a draft. So that way, if I did a draft, it would be the second revision of my draft. Once that is actually what we do also is once it's no longer a draft and it's the final document, it'll become version 1. That's the system we use. However, whatever system works for you, it's just important that before you start this process, you kind of get your rules in order. That's what I say. Determine when you would like to fully execute the new emergency plan, as that will be the date in the future when you're going to review your plan, either a year or 2 years from now. Excuse me. And what I mean by that is maybe it will take you a while to get this process finished. So maybe you're going to start in June, and then it might take me till October to finish all my drafts. Then maybe somebody has to approve them. And then once they're final, maybe you want to set your revision date, your executed date as January 1. Because that way I know every January 1, I'm going to go back and I'm going to review my emergency plan, see if anything's changed. And then I will always have that date in mind. It's really important because CMS does expect you to be reviewing those plans on a regular basis. And that is really around a specific date. And then last but not least, you cannot do this by yourself. It's very important that you have a team of people, maybe your safety committee or your safety team, or maybe you even have a few people who actually love doing emergency management, emergency preparedness. Corral them into this project, because emergency plans are really all about getting the right information in the right place. And you'll see that as you open up the templates, that there is very specific site information that you're going to have to gather, and that's going to take time. And so make sure that you have enough staff, enough help, that you can actually get that. Some of your information might have to come from different departments. Your communication plan might need to come from your administrator, or even if you have a marketing or a communications person or department, maybe if you're a larger organization, you're going to need all of their information. And you're going to have that go-to person within that department so that you can say, well, I need this and this and this. Okay. Or maybe it's something through your facilities. Maybe it's about your generator. And so you might have to have your facilities people give you, give that information about how they treat the generator within your building. Maybe you have a generator branch, but and so really, again, going to those specific people. And this is a big project, and so you don't really want to do it by yourself. You want to be able to do this in concert with other staff, so that it isn't only owned by one person. That's kind of a culture thing, but it's really just important that you enlist the help of your coworkers and team members to help gather this information, because it is quite a lot of information. Okay. Again, we wanted to talk a little bit about the 2020. We are actually in the process of redoing our toolkit, which will be out in early 2020. The new changes to the final rule, we talked a little bit about that. Things like changing the exercise requirements and the review process, and some of those timelines. Those will all be incorporated into the new toolkit. New provider reference charts will be on all the changes, and we will actually have it be a much more streamlined, smaller toolkit that will be, I think, a little more user friendly. So because you've actually purchased the toolkit, you're actually going to get all those changes, and we're not going to charge you. Isn't that awesome? So thanks for your purchase. I really appreciate that. And so all of these new training drills and exercises and resources will be in the new toolkit, but I think it will be an opportunity for you to streamline the process. And so that's a really good thing. And also it's a great chance to put those new rule changes in so that it's completely updated and CMS compliant, as it is now. Okay, so want to know about how we can further help your organization. Part of purchasing the toolkit is that you get 2 hours of consultation hours, which is a great value. And so it's really important that we want you to actually make sure that you're scheduling those calls. The 2-hour consultation hours, we wanted to kind of make it so that if you had 2 hours with our emergency management CMS specialist, that you actually got the most out of that time. So we want you to be able to schedule your consultation hours. We're not going to have it as a 2-hour block of time because we want to accomplish very specific things, but every program is different. Every program has something they need to work on or want to work on. And so for one organization, they might want to have us work to renew their HVA, their hazard vulnerability analysis, which could easily be done in a 2-hour time slot. So, or maybe you want us to review your policies and procedures because you feel like they need some work. And so this is your time, and it's very important that you give us, you schedule those hours with us in advance. Everybody's busy. And so we want to make sure that you actually, that isn't lost. Part of that process of the 2-hour consultation is also, we're going to be sending you a compliance review tool. So you can actually, before we even do this consultation, I want you to complete this. And it's a chance for you to give you a bird's eye view of where you are in terms of compliance and what you've done over the last 18 months. And so we're going to ask you to complete this review tool and then schedule your call. We're going to be doing probably a half-hour consultation call that will allow us to kind of figure out where you are in the process and what you want to work on. And then we will go forward once we figure out where your gaps are and what you actually want to work on. I just want to say we have a number of free free webinars for the community. And so again, you can look at there's a link, there's a hyperlink there if you wanted to see some of our upcoming new webinars, but you can also check out our website, and we also have a monthly newsletter. So it has lots of tips and tools, resources, and up-to-date information about things like the rule change, or just articles about how to, what is a PNP and how do you develop one. And so these are all resources that you can be accessing either for free or with us, you know, through the consultation hours and the compliance tools and even this webinar. Okay. Any questions? This is where I want to make sure that you do book your consultation time, and this is my information. So again, I'm Karen Garrison at Connect Consulting Services. I am the Director of Aging Services. We have an amazing team of emergency preparedness specialists, and led by our CEO, Nora O'Brien, who is a certified emergency manager. And at this time, I'm going to conclude this webinar and say thank you very much for joining us today.